Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm Jen McKenzie, Lymphoedema Physiotherapist and ESSA accredited exercise physiologist. In this video, I'm going to show you how to put on a compression sleeve and how to take it off if you've got lymphedema or if you are at risk of lymphedema and for certain circumstances are needing to wear a sleeve. I'm also going to talk you through the wash and wear instructions of your sleeve. So without further ado, let's get into this video. But if you do enjoy this content and you would like to see more, then please give this video a big thumbs up, subscribe to my channel, which is completely free, and leave a comment in the section below if you have any questions about compression garments, lymphedema, or any other topics around breast cancer. So without further ado, let's get into this video, how to put on a compression sleeve, including wash and wear instructions of compression garments. So firstly, when you are applying a compression sleeve, the technique I'm actually going to use today to get the sleeve on is with what's called a slider bag. So I'll just grab my little bag here. These are called Steve slider bags and they're fantastic because they really help get the sleeve onto the arm and generally over the elbow joint and the wrist joint. So I'm just going to hold up the packaging of this product, which is from a company that I use all the time. They're absolutely fantastic, Haddenham Healthcare, who are based in Melbourne in Australia, but I love these slider bags. You don't have to have this particular slider bag. There are other bags on the market, but this is my go-to brand, and I use the company Haddenham Healthcare all the time for compression garments and other products. And they're fantastic. Their customer service is outstanding. So this is the slider bag I'll be using in this video. I'll put the link in the comment section below, or the description below, I should say, if you would like to go and purchase one of these online. So I'll just pop that one down. So when you get your slider bag, you'll actually see, well, it'll actually look like this. It'll look like a big, long piece of material. So what you want to do is find these little white tabs, which are on either side, and then you need to turn them to a position so that the white tabs are at the top like so, because this is your starting point to get your sleeve on. So this is a sleeve I'm going to put on my own arm today. I specifically picked this sleeve because I know it fits my arm. And one of the most important take-home messages with this video, guys, is that it is actually more dangerous for your lymphedema if you're wearing a poorly fitted sleeve than to wear nothing at all. So when we are talking about wearing compression garments, just make sure that the sleeve you're wearing fits your arm really well. And if you're not sure whether it fits well, get it assessed by a lymphedema therapist, whether that's a physiotherapist, occupational therapist, or anyone who's got a lymphedema qualification. So this is an off-the-shelf sleeve. There's different types and styles of sleeves. This particular sleeve is a Medi Harmony. That's sort of irrelevant for this video, but I'm just letting people know, just in case they want to know what sleeve this particular one is. As I said before, the only reason I've got this one is because I know this one, generally fits my arm. So what we do is we also use gloves, because these are fantastic for gripping the garment and pulling the garment on, because the last thing you want to do is put runners in the garment. Like when you're putting a pair of stockings on, the last thing you want to do is damage the garment as soon as you're trying to pull it on. And like I said before, the rubber on these gloves grips the garment and helps you pick it up. It's also really good if you're helping someone else put a garment on, that you don't pinch their skin when you're trying to lift the garment up. This will make a little bit more sense when I demonstrate it in a little while. Interestingly, the brand of these gloves, I'll just hold them up there, are also Steve, also available through Haddenham Healthcare. So again, I'll put the link to Haddenham Healthcare in the description bar below. So if anybody does want to specifically buy these gloves, you can access them through there. But just so you know, there are other options available. You can get washing up gloves from your local supermarket, or you can go to gardening shops, and usually there'll be a variety of gardening gloves that have just got rubber on the back that are usually pretty cheap and pretty readily available to buy. So those are the two pieces of equipment, the gloves and the slider bag to get the sleeve on. So now, just before we pop the sleeve on, one of the little topics we should briefly talk about is when people should actually be wearing a compression garment, because one of the most common questions I get is, when should I wear a sleeve after breast cancer treatment? Now, one of the times you don't have to wear a sleeve is if you are only at risk of lymphedema. In saying that though, so what I mean by this is, if you are, if you've gone through breast cancer treatment and you've had lymph nodes removed, that means you are at risk of lymphedema. That doesn't mean you have to go and put a sleeve on straight away. There is no strong evidence to suggest that just wearing a sleeve is going to prevent the onset of lymphedema. However, if you are going on long haul flights, so anything over 4 hours in length on a plane, or if you're going on a really long car ride for the same sort of number of hours or longer, that's generally when I'm recommending for my patients to potentially wear a sleeve. It's totally up to them if they do it or not, but that's generally the current prevention guidelines for lymphedema, is to wear a sleeve. Whether you've got lymphedema or not in those circumstances, if you've had lymph nodes removed and you're at risk of lymphedema, or you have lymphedema and you're going on a long haul flight or a long car ride, that's one time we certainly would recommend that you wear a sleeve. The other times that you're going to wear a sleeve is obviously if you have existing lymphedema, or if there's particular activities which by which you know your arm does swell mildly. So some people are at risk of lymphedema, but it's, you know, circumstances by which they might go and do exercise and they find their arm just gets a little bit puffy afterwards. So that might be a circumstance by which that person just wears a sleeve when they are exercising, but for the rest of the time they might not have to wear their sleeve. So if you get, you know, what I coin a lymphatic response, that might be when you're wearing your sleeve. So let's pop this sleeve on. So say I'm putting the sleeve on my left arm, because I'm going to do that for the purpose of the position I'm sitting in this video. If I was to put this sleeve on by myself, I would just put my right hand glove on. So I'm just going to do that first. So I've got my right hand glove on, and then I'm going to put the slider bag on. Now, what's interesting is so that slider bag has a hole in it, which is a closed hole, and I'll show you what this little hook's for in a second, or loop's for. So once the bag is on the arm, you'll notice that it only comes so far up the arm. We don't actually want it to come all the way up to here, which is a common misconception. People think, oh gosh, I'm never going to be able to get this sleeve on because it doesn't come all the way up. But once the sleeve is on, if you've got a really long slider bag and the bag is across the elbow joint, you've got a hell of a time pulling that sleeve off, the slider bag out. So you actually only want the slider bag to sort of come 2/3 of the way up the forearm. So we're just going to grab the sleeve now with the other hand, and we're going to put the this hand into the base of the sleeve. So we just tuck it in like so. And then this is the point at which you're going to pull the sleeve up from the top, up over, and as high as you can get it. Now, I've only got this sleeve just to my palm here. So this is where the glove starts to come in really handy, because I can start to slide that sleeve onto my arm. Whether I pick it up or slide it is your choice. Sometimes people don't have the finger grip strength, but if you can, you can pick the sleeve up, because we do want to get the material completely flat, and we want to get this little part at the top. Some sleeves have what we call a grip top at the top, which is, preventing the sleeve from sliding down through the day. It's a little bit of an anchorage point. So that sleeve is now on my arm nicely. This job obviously is a lot easier if you've got another person to help you. So if you do have someone around at home that can help you, by all means, go for it, get them to be involved. Now, when we're pulling the slider bag out, one of the little tricks is to pop this on a door handle and hold the base of the sleeve and then walk backwards, so the slider bag just pulls out and you don't get a drag of the sleeve coming down over your wrist. However, even if that does happen, so even if I pull the slider bag off, and of course it hasn't happened in this demonstration, but even if my sleeve was down here, you can work it backwards with the glove. You can pick the fabric up as before. So there's my compression garment on my arm. You'll notice as well up here, it's not butting up into my armpit, because when I rest my arm, I'll just pop myself up here so you can see this. When I rest my arm against my body, I don't want the sleeve pushing up into my armpit and making that area really irritated. So if that happens, your sleeve might be too long for you, or you might have just pulled it up way too far, because you'll notice if I do put this on, I can actually get this sleeve to stretch and probably sit too high. So you can adjust sleeves once they're on. And again, this is where the glove comes in really handy. So there's my compression sleeve on, not butting up too high into my armpit, not sitting too low on into my hand, because you want to be able to move your wrist freely and not create any bunching when you have got the sleeve on. Okay. Now, if we were going to take the sleeve off, the good news here is that we literally just slide it off like a sock at the end of the day. So it's a lot easier generally to pull the sleeve off than it is to get some sleeves on. But I must say, with practice, you will get better at it. And like I said before, if you've got someone else at home that can help you to get the sleeve on if it's a little bit tricky, or particularly in circumstances where you've got a sore shoulder or you've got arthritic hands and it's just really difficult to pull or grip or move your shoulder into a position by which, you know, you can slide that sleeve on. So that's getting the sleeve on and off. Let's talk about wash and wear instructions for the sleeve. So in the majority of compression garments, when you wear them for, say, 48 hours, so during the day for a couple of days, they will actually stretch out a little bit, like a pair of jeans. If you wear them for a couple of days, they will stretch out, and then you wash them. You might put them through the dryer, or they hang them on the clothesline, you pop them back on and they feel really nice and firm and snug again. The same thing happens with a compression garment. So you probably want to aim to wash the sleeve at least every 2 days. So I wouldn't wear the sleeve for a whole week and then wash it. I would be aiming for every 48 hours to wash that sleeve. This is where having a second sleeve can be handy. If you've got chronic lymphedema and you're wearing a sleeve every single day, having one to wash, one to wear can be really, really helpful. But if you do need to wash a sleeve every second day, that is actually going to do you benefit from a compression point of view, because if this sleeve is not washed and you wear it for, say, 5 days in a row and it starts to stretch, you're not going to get the same compressive force. So if anyone is, you know, trying to, say, reverse early onset lymphedema and they're finding that their LDEX score is not dropping and the volume of fluid in their arms not dropping, it might be because you're not washing your sleeve regularly enough. The other reason we want to wash the sleeve every couple of days is just for hygiene purposes. So skin cell turnover happens about every 48 hours. So we do want to, you know, make sure this stays clean. It's also very important to keep your skin, you know, hydrated and clean. I'll put a little link in this video to one of my other videos, which is on why you should moisturize your arm after breast cancer treatment when you've had lymph nodes removed, because we definitely don't want to create a situation by which we're causing any sort of bacteria or skin infection around the skin of the arm where lymph nodes have been removed. Let's just talk about washing specifically for a second. It's better if you put these garments in a washing bag if you are putting it in the washing machine. And if you were to put it in the washing machine, we tend to recommend a liquid laundry detergent rather than a fabric, because the powdered detergents can be a little bit too abrasive on the fabric of the compression garment. So yeah, aim for a laundry detergent that is liquid form rather than powder. And apart from putting in the washing machine, of course, you could hand wash it if need be, again with a liquid soap rather than anything powdery. When we're drying the garment, we ideally actually want to lay it flat between two towels, because as you can imagine, if you were to hang that garment wet over a clothes horse or a clothesline, you're going to get a bit of drag, and it's just going to be stretching on that garment and potentially reducing its lifespan just because of that weight and that stretch. So lying it flat between two towels is a really handy way to care for your garment long term. And we must remember as well, guys, that if you're wearing a compression garment every single day or every second day even, the lifespan of that garment is around 6 months. So every 6 months you usually would be aiming to replace a garment that's being worn on a daily or every second daily basis. The other thing to note is that a lot of these garments have an elastic core in the compression fabric, so allowing them to dry in direct sunlight is not a great idea because it can damage the elastic core in the garment fabric. So ideally drying these in between two towels flat is better. Obviously, if you've only got one garment to wear, it makes it a little bit tricky because drying them, particularly through winter time, or having enough time to have them dry for the next day, can be a little bit of a problem. So yeah, having a second garment's a great thing, and make sure that if you are financially strained and you need to get your hands on a second garment, that you look into all potential options, particularly through your public hospital systems, as to where you could source a second garment from. Another note on drying your garment: definitely avoid tumble dryers, because in a dryer this garment is just going to get smashed physically around, and stretched and pulled. So definitely avoid a tumble dryer when trying to dry the garment. I'll quickly mention too, as I said before, this garment as an example has a grip top on it. So you can see if I hold that nice and close to the camera, I'll see if we can get it in focus. This is a grip top. So just keep an eye on the integrity of those grippy areas, because they sometimes can degenerate over time as well, probably with a lot of washing and wearing. And if that starts to let go, that might cause slippage of the garment. So if that starts to happen, that may impact how well the garment performs over the course of the day. You may find you hiking the garment up all the time. Might just be because there's a little bit of degeneration of that grip top. Thank you so much for watching this video. I hope you found this content really informative. If you have any questions around compression garments, slider bags, gloves, please reach out and let me know in the comment section below. I release a new video every week around topics on breast cancer. So if you've enjoyed this content and you would like to see more, then please subscribe to my channel, which is completely free. Leave a comment in the section below and give this video a big thumbs up. I hope you're having a fantastic week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio. I'll see you next time.